Hello everyone, this is my research design for our final project. My name is Whitney Pollock. For my research question is, what is the correlation between childhood abuse and dissociative identity disorder, or DID? Why is this research topic important? It's important because childhood development is vital to the rest of the child's life. Childhood sexual abuse occurring in children under 6 years old is associated with DID. A child's upbringing can set the course for if they will have a mental health diagnosis in the future. Literature review. 2 research studies that I chose to review for this presentation. The first article reviews the cognitive functioning of a DID patient. Personalities of the patient can be correlated to the patient's traumatic history and experiences while growing up. Diagnosis, treatment, and the patient's history are analyzed in the article. The author also mentions that the misdiagnosis and confusion over DID are an important issue to address and discuss. The second article is a literary review of the mythology of Medusa and using it as a narrative for emergent DID diagnosis. This includes the etiology, recognition, and treatment of DID. The author mentions how multiple personalities are created to separate the individual from traumatic experiences. The story of Medusa, as well as the review of the 2 case study patients with DID, are used to explain the relation. Potential methods. I will be using a mixed methods approach. Qualitative approaches are important when obtaining deep and meaningful information within studies. Quantitative approach is beneficial when needing statistics and numerical data to produce findings. Ethical issues. These issues listed below are APA ethical principles in the Code of Conduct. There are a few that pertain to my research study. Section 4 in the APA Ethical Guidelines outlines the importance of privacy and confidentiality. Limits of confidentiality must be discussed with all those participating in a study. Informed consent must also be applied to anybody who is participating in a study. Section 3.10 in the guidelines explains that responsibility of those conducting a study to obtain an informed consent. These include explaining the study in the participants' language for their complete understanding. Since privacy and confidentiality are important when working with any patient, I think especially with patients who may have trouble trusting others. Codes such as 4.01 and 4.04 can ensure that the patient feels safe to talk and participate with a mental health professional. Code 9.02 is applicable to my study when it pertains to patient interviews and how they will be used. For some patients who have been diagnosed with DID, they have survived extreme childhood abuse, including sexual abuse. It's important to understand that when working with DID patients, their minds fragmented at a young age to save them from the reality of their severe trauma. Here are my references. Please let me know if you have any questions. Thank you.